Bryony was just a normal student at university. But when she developed mental health problems, her life changed forever.
They started about 10 years ago, and I saw numerous psychiatrists, but none of them picked up on the fact that I was deeply unwell. I developed a delusion that this local ex-policeman had drugged my food from a Chinese takeaway with tapeworm eggs. It was all in my head, but it was very real to me.
Bryony, not her real name, had undiagnosed bipolar disorder. She was arrested for malicious communication and attempted arson. But instead of going to hospital, she went to prison.
It was the worst experience of my life. I started to self-harm because we were allowed razors in our cell. It was basically a way to cope with my surroundings. When you're psychotic and depressed, being locked away in a cell is one of the worst things you can do to someone. It was just a shocking trajectory, really, from happy student to being locked away.
Sadly, Bryony's experience is not unique. In 2023, self-harm in women's prisons rose by 65% in a year, and it's at record levels. Now, a new report reveals the extent that acutely unwell prisoners, both male and female, will go to hurt themselves. In a report exclusively seen by Sky News, His Majesty's Chief Inspector of Prisons says some mentally unwell prisoners are so driven to harming themselves, they have removed teeth or maimed themselves to the point of exposing their own intestines, frequently causing life-changing injuries. But prisoners are waiting long periods before they reach hospital. NHS guidelines stipulate mentally unwell prisoners should be transferred within 28 days from that need being identified. But 85% of prisoners are not transferred within that deadline. The average wait was 85 days, with one person waiting over a year.
This is some really serious manifestations of some very, very unwell people, but also some of these people who are involved in violence as well, so they're a threat also to officers and to staff. And because of that, very often they are moved to segregation units, which are wholly inappropriate places to be keeping people who are mentally ill.
Why are prisoners waiting so long to be transferred to a psychiatric hospital?
There aren't enough beds of the right suitability for people who are in prison within hospitals. What we come across is cases where prisoners used in effect as a place of safety. So out in the community there is no provision in place for someone who's very unwell, and therefore sometimes magistrates or judges will send them to prison simply because there's nowhere else for them to go.
Marilyn Reed's daughter Sarah died in jail in 2016. She was placed in prison on remand solely for psychiatric reports to confirm whether she was fit to stand trial.
I felt it was ridiculous to see her in Holloway, to see she was fit to go to trial, because she was known to the mental health teams in a local area. She had been a patient of theirs for coming up to about 11 years. She'd been diagnosed with schizophrenia. The original crime that she was going to go trial for was in a mental hospital where another patient, much older than her, tried to sexually assault her.
Sarah was kept in isolation, unmedicated, and on the 11th of January, she was found dead. She was just 32 years old.
She'd be looking around and waving in and out and saying, "Mum, I need my meds, I can't sleep. I need my meds, I need my meds, I can't sleep." She looked really bad. And as I said, she also had these two black eyes that were, when I saw her, I found it shocking. She just looked to me like she was suffering, really suffering. "Please, please get me out of here, Mum." That was the last thing she said to me.
The government says providers in prisons have clear processes in place to identify, assess and treat offenders with mental health needs. NHS England is investing in post-custody care to help prison leavers access their community-based health services. After 6 months in prison, Bryony was sent to a psychiatric hospital where she finally got a diagnosis of bipolar disorder.
I started the treatment straight away. I don't know if getting arrested and getting sent to prison was the right response. Obviously what I did was very serious, so there had to be some kind of response. But I think perhaps it might have been more beneficial if I'd have been taken straight to hospital instead of prison. And I've never seen people so unwell before, and prison just made their illness 10 times worse.
Bryony is now back studying at university. She's optimistic about her future. But for many of those who remain locked away, it's still a long wait to get the help they need. Alice Porter, Sky News.